Hello friends, welcome back to my channel. Today I will discuss with you regarding tissue plasminogen activator. It is also called TPA and it is a mainly injection which is given for lysing of the blood clot. Okay, so in this mainly for this the medication name I will tell you later. First, the suffix which is used for this medication is ACE and the medication name is generic and trade name. First, altiplase is also called activase or litiplase is also called litivase. Then is streptokinase and tenectoplase is also called TNKase. Okay, so these are the medication names which is used as a TPA. And another is medication class, in which class this medication is undercome. So it is first is thrombolytic, in which mainly blood clot is there and having to do with lysis, that is destruction of the blood clot. So main action of this is thrombolytics. Okay, then is fibrinolytics, that is fibrin, that is protein. It will TPA bind with fibrin in the clot and after that it will destroy that clot. Okay, so this is a class. Next is the mechanism of the action. So first TPA, that is tissue plasminogen activator, will bind to the fibrin. Fibrin is a protein of an existing clot. Okay, so fibrin is a protein that helps form blood clot. Okay, so this protein will help to form a blood clot. After that it will convert plasminogen to plasmin. Okay, so plasmin is the help in breakdown of fibrin. Okay, after that clot will burst, means clot will apart or dissolve, which the process is called clot buster. And after that it will convert into blood vessel reopen. So with the help of this, the blood vessel will be reopen and the blood flow will be improved. So this is the whole mechanism with the TPA injection. Okay, next is the therapeutic uses. So the main use of this TPA is in the acute myocardial infarction, that is also called MI, and it is mainly the obstruction of the blood flow to the heart, and this TPA will help in this. Okay, second is ischemic stroke. Mainly ischemic stroke is due to the lack of oxygen supply to the brain blood vessel, and in this mainly brain is involved, and due to the lack of or any necrosis or any fatty deposition, the blood clot will be formed. So it will used in the ischemic stroke also. Next is the pulmonary embolic, and in this mainly in the lungs we can use this. Any obstruction in the lungs with the blood flow is there, so we can use this TPA. So mainly these are the therapeutic uses in for the TPA. Okay, next one is must keep side effects. So which all the side effects with the TPA injections are there. The main side effect is the internal bleeding. So like patient will complain of abdominal pain. Okay, there is coffee ground emesis, and that can be due to like a red blood. Okay, so that is means dark red blood, that means old blood. And if the blood is bright, then it is active bleed, means that is current bleed. Okay, and next is hematuria, means blood in urine. Hemoptysis, that is coughing up blood, that is coughing up of blood. Then is black and tarry stool, indicates bleeding somewhere along the GI tract, that is gastrointestinal tract. Okay, so these are the side effects with the TPA. Next is the nursing considerations, which all point nurses kept in mind while treating with the TPA patient. And the first one is always avoid new injection or punctures like IM injection, that is intramuscular injection, then IV injection, that is intravenous injection, and subcut injections. Because with this, if we can poke a new injection or then there is a risk of bleeding. Okay. Next is always administered TPA within 3 to 4.5 hours after the onset of the symptoms, because TPA will act within this period of time effectively. Okay. Then last is the contraindications. So in which cases we cannot give the TPA injection. First is any active bleed. Okay. So we cannot give the TPA injection to that patient. Another is suffered from recent head trauma. So if there is any head trauma, obvious there is a bleed, chances of bleeding. Okay. Then is history of hemorrhagic stroke. As the patient is having hemorrhagic stroke, already patient is having bleed, so we cannot give this patient to TPA. Okay. Another one is uncontrolled hypertension, that is more than or equal to 180 to 110 mg per dl. Okay. So means uncontrolled hypertension the case, we cannot give this TPA. Okay. So this is all regarding the TPA injection, which is very important nowadays. Mostly in stroke patient we are giving TPA injection, and there is a 90% chances that most of the patients are having proper healing. So thank you for watching my video. Thank you once again.